we are showing you some cutting-edge skin treatments for the new year. Board-certified dermatologist Dr. William Groff is here to show us what we can expect in 2012. Good morning to you.
Good morning. How are you?
All right, so let's start first with this new tattoo removal. What's up with this?
Sure. Well, the lasers really haven't changed that much, but our technique or approach to treating tattoos have changed. So what I want you to imagine is if we took a piece of skin that has a tattoo on it and we looked at it under a microscope, what it would look like is you would see round spheres of ink essentially under the skin. That's what a tattoo looks like under a microscope. Now when I fire the laser, it strikes those particles and breaks those into smaller spheres of ink. Okay? So traditionally we would just do one treatment in a day. The patient would come back in maybe 1 or 2 months. You do a second treatment. Well, the way we're approaching it now is in one day we will do multiple treatments on the same tattoo. So the first treatment breaks down the particles to a smaller size. The subsequent treatment breaks down to an even smaller size. And the smaller the particle, the easier it is for the body to go in, absorb, and excrete that ink from your body. So we're seeing that we're able to cut down the number of treatments or treatment days significantly.
And is this more expensive, or what's the price on this?
Well, because there is multiple treatments in one day, it will be more expensive than your traditional one treatment in one day.
But you feel like it's more effective?
It's more effective, it's quicker, it requires less visits to the office. We're actually doing a study on this right now to confirm it, but we've been doing this for a couple of years in our office, so we know it works, but we want to do a formal study to publish and so forth.
And what's this called again?
Well, the treatment's called, it's just multiple tattoo treatments in a single day.
Okay.
But there's various different lasers we use. We have probably about 5 different lasers we use in our practice to treat tattoos. And we can treat, the other new thing is that we can treat any color tattoo now using what's called a fractional CO2 laser.
And we were looking at some before and after pictures just a second ago. If we can pop those back up, you can see.
Yeah, so this is a female patient of mine that had a huge tattoo across her chest, and we were able to eradicate it really using this technique.
Oh, this is across her chest.
Yeah, actually you can see her shirt, her scoop neck shirt there. You can see the tattoo across it, and I mean, obviously she was ecstatic because this is something, like with a lot of patients, that they get these tattoos when they're young, and you know, they get things that they're going to regret when they turn 30 or older. You know,
and that one's significant because usually even if people get them removed, you can still see the remnants of it. I couldn't tell at all with that one. Okay, so we have some new Botox type treatments?
Right. So I brought in these 3 different types of cola to compare. There's 3 different Botox-like products.
Okay.
Botox, of course, everyone's heard of Botox, just like everyone's heard of Coke. They've got the brand recognition. Tens of millions of people have been treated with this. You know, who knows how many people drank Coke. So this is the original. Been around for about 30 years in the U.S. market, used by doctors. Cosmetic approval about 10 years ago. Now we have Dysport, which is similar to RC Cola. It's got a much smaller fragment of the marketplace, maybe 10 to 20% tops. It works very similar, just like all these sodas or colas have similar formulations. There's just small little tweaks that make them slightly different, but they do essentially the same thing. Now the new guy on the block is Xeomin, okay? And this just came out a few months ago. Just like this cola here, most people never heard of Refresh Cola. Well, most people haven't heard of Xeomin. But essentially, they all do very similar things, just like these colas all taste very similar and they're refreshing and so forth.
And these are going to be less expensive because you don't have the brand recognition?
Right. Just like Coke's going to be more expensive than these two, Botox is going to be more expensive because it's been around forever. Everyone knows it. I mean, think about it. If you ask someone, have you ever heard of Botox? 99% more people have heard of Botox. These guys, most people haven't heard of, so they're going to come in priced a little bit lower.
So you were saying this like maybe 20% less?
Yeah, roughly. We're still trying to figure out, the dosing is very similar, but we might need to dose this a little bit differently, but it will be a little bit cheaper regardless.
Okay, real quickly, I want to get to this. Is it Laviv?
Laviv.
Laviv, what is this?
This is a very interesting cutting-edge technology. It's an FDA-approved product that we use to help soften lines around the mouth.
Okay.
And this one's particularly good for, I think there's a photo, for really fine etched lines around the mouth. Its FDA approval is for nasolabial folds and fine lines in that area. As you can see in this patient here, you can see a nice reduction in the fine etched lines around the mouth, which we don't really have a good product for, but the really interesting part of this is the way it's made. If you were my patient, you would come into my office, I would take a small sample of skin from behind your ear, I send it off to the lab, they take that specimen, they break it down, and they break it down to cells called fibroblasts. These are the cells that produce collagen, okay? So they'll take that and they'll use your own skin to make millions and millions of fibroblast cells. They ship that back to me in my office. I inject these fibroblasts, or these collagen-producing cells, into your lines. It's like your personalized own cell therapy.
Wow.
So
Real
it's pretty
quickly,
amazing.
how much does something like this cost?
It is quite expensive. It's going to be in the order of $2,000, $3,000, maybe even $4,000. You usually have to do at least 3 treatments spaced about a month apart. So even though it's your own customized cell line, so to speak, it is expensive.
It is still really pricey.
Yes.
Dr. Groff, thank you so much
Thank
for being
you.
here.
Thanks
We
for having
really,
me.
really appreciate it. And to get a hold of Dr. William Groff at Cosmetic Laser Dermatology, which is located on Genesee Avenue in the UTC area, you can go to our website, fox5sandiego.com. Click on that Scene on tab. Raul, can I just tell you, nerds are my favorite candy ever.
Ooh, there's nerds.
And gumballs.
It was for
I
the
love nerds.
It was for the tattoo demonstration, but
My daughters freaked out when I took these out of the house this morning, by the way.
How many little boxes did it take to fill that
I
bag,
just need
too?
a little bit. I just need a little bit of nerds.
Share. I'm sharing
Okay.
wine guy with you today,
Okay.
so you need to share the nerds with me as well.
Okay,
Thank you,
sounds
doctor. Appreciate it. Leave the bag, by the way. Good stuff.